Hello, everyone. My name is Meena Ramchandani. I'm an infectious disease physician at the University of Washington in Seattle. This podcast is dedicated to an STI literature review for healthcare professionals who are interested in remaining up to date on the diagnosis, management, and prevention of STIs. A few manuscripts have recently been published describing 2 new antibiotics to treat Neisseria gonorrhea that I'd like to review in this episode. One of the antibiotics is called Zoliflodacin, and the other is Gepotidacin, both of which are given orally. The articles we review in this episode will cover the efficacy and safety of each of these antibiotics to treat uncomplicated urogenital gonorrhea when compared to ceftriaxone plus azithromycin for this infection. Now, the production of these antibiotics is timely as antimicrobial-resistant Neisseria gonorrhea continues to increase worldwide. And ceftriaxone is the only remaining treatment option in most countries, and resistance or decreased susceptibility to ceftriaxone has been reported. Ceftriaxone is given intramuscularly, which can be challenging for some situations, and it would be nice to have oral antibiotics to treat this infection. Oral antibiotics are sometimes patient-preferred. They're easier to administer for patients who live in remote locations, and they work better for telehealth visits. They're also a possible option for expedited partner therapy. So let's talk about some recent articles that have been published on this topic. The first article to review was published in Lancet in May of 2025 by Dr. Ross and colleagues. It is titled Oral Gepotidacin for the Treatment of Uncomplicated Urogenital Gonorrhea, also known as EAGLE-1, a Phase 3 randomized open-label, non-inferiority multi-center study. Now, we introduced Gepotidacin in our December 2025 episode when we were reviewing abstracts that were presented at the 2024 STI Prevention Conference. And for some background, Gepotidacin is an antibiotic that inhibits 2 different bacterial type 2 topoisomerases by a unique mechanism of action. In this study, 628 participants who were aged 12 years or older with uncomplicated urogenital Neisseria gonorrhea were enrolled in 49 locations in 6 different countries. The participants were randomly assigned to receive either oral Gepotidacin or intramuscular ceftriaxone plus azithromycin for treatment. Now, in this study, they used 2 doses of Gepotidacin 3,000 milligrams orally, which were administered 10 to 12 hours apart. Now, this is different than a 2018 study, in which a single dose of Gepotidacin was used to treat uncomplicated urogenital gonococcal infection. In the 2018 study, 96% of participants had microbiological success, or cure, but there were 2 participants whose isolates had development of resistance to Gepotidacin. So in this study, they used 2 doses of Gepotidacin 3,000 milligrams orally, instead of the 1 dose that was used in 2018. The majority of patients, or 92%, were male, 71% were MSM, 74% of patients were white, 15% Black or African American, and 17% Hispanic or Latino. When they looked at participants in the results of the evaluable population, and the evaluable population, which are those who received all treatment doses, had urogenital specimen collected at the test of cure visit with available culture results and did not take other antibiotics during the study period, they found that microbiological success was 100% in both treatment groups for urogenital gonorrhea. That's in the treatment group who received Gepotidacin, but also the treatment group that received ceftriaxone and azithromycin. They did a secondary analysis for those with pharyngeal gonorrhea, and they found that success of treatment was 88% in the Gepotidacin group and 100% in the ceftriaxone plus azithromycin group, although the sample size was small. 2 participants with pharyngeal gonorrhea did have bacterial persistence after Gepotidacin treatment, but they found that there was no evidence of resistance or reduced susceptibility to Gepotidacin in the Neisseria gonorrhea isolates of those participants. Treatment success for rectal gonorrhea was 100% in both treatment groups for the evaluable population, although the sample size was also small for those participants with rectal gonorrhea. Those in the Gepotidacin treatment group had more gastrointestinal adverse events, but they were all mild to moderate. Patients who took Gepotidacin had more nausea and diarrhea than those who received ceftriaxone plus azithromycin. There is a need for more antibiotics to treat gonorrhea infection, especially antibiotics with different mechanisms of action, ways of administration, and ability to treat antimicrobial-resistant gonorrhea. Now, this study found that oral gepotidacin was non-inferior to ceftriaxone plus azithromycin to treat urogenital gonococcal infection, and they found that no bacterial persistence of urogenital Neisseria gonorrhea was observed at the test of cure visit. Many Neisseria gonorrhea isolates in the study were resistant to other antibiotics, such as ciprofloxacin and tetracycline. And although the sample size was small, gepotidacin was effective in treating gonococcal infections at the rectal body site and most infections at the pharyngeal site, although there were 2 failures in those with pharyngeal gonorrhea. Let's discuss a different antibiotic that was evaluated to treat Neisseria gonorrhea. This article was published in Lancet in January 2026 by Dr. Lucky and colleagues. It is titled Zoliflodacin versus ceftriaxone plus azithromycin for the treatment of uncomplicated urogenital gonorrhea, an international randomized controlled open-label phase 3 non-inferiority clinical trial. We were introduced to Zoliflodacin in one of our first episodes from October of 2020, reviewing a manuscript written by Dr. Taylor and colleagues that was published in 2018. Just some background, Zoliflodacin is an oral antibiotic that inhibits DNA topoisomerases and the formation of circular DNA required for bacterial replication. The antibiotic maintains activity against antimicrobial-resistant Neisseria gonorrhea strains. In the study, 930 participants aged 12 years or older were randomly assigned to receive either a single dose of 3 grams of oral Zoliflodacin or the standard dose of intramuscular ceftriaxone plus azithromycin for uncomplicated urogenital gonorrhea infection. Participants were enrolled from 17 clinics in 5 different countries. Most of the patients, or 88%, were male, 55% were Black or African American, 31% Asian, and 12% were white. In the evaluable population for this study, and that means those participants who had a Neisseria gonorrhea culture result at the test of cure visit, the authors found that 97% of participants in the Zoliflodacin treatment group and 100% in the ceftriaxone plus azithromycin group were successfully treated for their urogenital infection. Oropharyngeal gonorrhea cure rates were 91% in the Zoliflodacin treatment group and 96% in the ceftriaxone plus azithromycin group for the evaluable population, although the sample size was also small in the study. Rectal gonorrhea cure rates were similar to urogenital cure rates, with 96% of participants in the Zoliflodacin treatment group and 100% in the ceftriaxone plus azithromycin group successfully treated. The authors did not find evidence of emergence of resistance to Zoliflodacin in the study for isolates from any of the 3 anatomical sites. Overall, the antibiotics were well tolerated, and most adverse events were mild to moderate and similar between treatment groups. So we now have 2 different oral antibiotics with unique mechanisms of action to treat uncomplicated urogenital gonorrhea, and these might be useful for extragenital infections as well. These antibiotics are effective against isolates with antimicrobial resistance to other antibiotics. This is exciting research and a big deal because new antibiotics to treat Neisseria gonorrhea have not been developed for some time. In the study that we just reviewed, pharyngeal and rectal gonorrhea cure rates were greater than 90% with Zoliflodacin for the evaluable population, or those who had a Neisseria gonorrhea culture result at the test of cure visit. The treatment success of Zoliflodacin against oropharyngeal gonorrhea is promising, especially how challenging it is to treat oropharyngeal gonorrhea because there are very few antibiotic options available. The next article to review was published in Lancet Microbe in October 2025 by Dr. Unemu and colleagues. It is titled WHO Global Gonococcal Antimicrobial Surveillance Programs 2019 to 2022, a retrospective observational study. The WHO Gonococcal Antimicrobial Surveillance Program is a collaborative global network of reference laboratories to collect gonococcal antimicrobial resistance data, and they also connect with the individual national surveillance programs that monitor gonococcal antimicrobial resistance in different countries. Gonococcal isolates from 77 countries were tested for minimum inhibitory concentrations to ceftriaxone, cefixime, azithromycin, and ciprofloxacin in each country, and the authors found increasing resistance globally. What they found is that 39% of countries reported Neisseria gonorrhea isolates with resistance to decreased susceptibility to ceftriaxone, 50% to cefixime, 88% to azithromycin, and 99% to ciprofloxacin. In the Western Pacific region, resistance or decreased susceptibility to ceftriaxone was higher than other regions. For example, in Cambodia, China, and Japan, more than 5% of isolates were resistant to ceftriaxone. The authors also note another study which showed that 5% of isolates in Malaysia and Vietnam were resistant to ceftriaxone as well, and Vietnam had the highest level of ceftriaxone resistance globally. The study shows that Neisseria gonorrhea isolates with ceftriaxone resistance or decreased susceptibility to ceftriaxone remains a concern and is increasing worldwide. When they compared their results to an analysis done in 2017 to 2018, they found that the number of reporting countries, the number of examined isolates, as well as the number of resistant isolates have increased overall. Resistance or decreased susceptibility to ceftriaxone and cefixime are increasing, especially in countries in the Western Pacific region. To conclude, I'd like to summarize some key points from this session. Gepotidacin is a novel oral antibiotic that demonstrated 100% treatment success in participants with urogenital gonorrhea and the E-valuable population. The antibiotic may also be effective against rectal and some cases of pharyngeal gonorrhea, although further studies are needed in this area. Oral Zoliflodacin successfully treated urogenital gonorrhea in 97% of participants and was non-inferior to ceftriaxone and azithromycin. Although sample sizes were small, pharyngeal and rectal gonorrhea cure rates were greater than 90% with oral Zoliflodacin, which is promising. Antimicrobial-resistant Neisseria gonorrhea remains a global public health concern. New data indicate azithromycin resistance is increasing globally, and resistance or decreased susceptibility to ceftriaxone and cefixime is also increasing, especially in the Western Pacific region. Global surveillance is essential to control the spread and impact of gonococcal antimicrobial resistance. This podcast is brought to you by the National STD Curriculum, the University of Washington STD Prevention Training Center, and is funded by the Centers for Disease Control and Prevention. Transcripts and references for this podcast series can be found on our website, the National STD Curriculum, at www.std.uw.edu. Thank you for listening and have a wonderful day.